Hello everybody, welcome to my channel OSCE with Bimal. Today we will be discussing about neurovascular observation chart, how you have to fill up the neurovascular observation chart in case of OSCE scenario in Australia. Okay, so we will see what's going to happen in case of a neurovascular observation chart as well as how you are going to fill up. So there can be upper limb will be there and also lower limb will be there. So we will be looking into upper limb first and thereafter we will be going for lower limb. Today we will be discussing about upper limb. Okay, so what's going to happen in case of the patient over there is so this is the first page over there. So this is going to give you some guideline. So these are the patient information over here, and these are the pathways or nerve sensory pathways where you have to look for patient's sensation. This is the pulse sensation, and this is the finger movement you are going to check. Okay, and this is the finger movement you are going to check. This is the guideline over there. So I see what's going to happen over here. So what's going to happen at this stage, this is the chart over here. So in this chart, what you are going to do is there is a column over here that's going to give you some information about the patient details. It's here, and this is the upper limb neurovascular observation chart. So once you get the picture, this chart, then what you have to do is there is these are the baseline values that will be given for you. Sometimes it's given, sometimes it won't be given. Okay, right and left, what is the plan with the movement, sensation, pallor, temperature, capillary fill, pulses and pain. Okay, all these things are there. So here what you are going to do is you have to look for the once you got it. So here what you have to do for, you have to tick which one is applicable, left or right. Okay, so for example, if you are going for left and right, you need two charts of this type. Okay, so for example, you are going for the right, you tick the right over here, and you have to put a date and you have to put a time. Okay, next what you have to do is once you are going for the upper limb assessment, usually an actor will be there. You ask the patient to extend his arm. Okay, so once you are going to, when the patient is going to extend his arm, you have to palpate both arms and see the color of the arm. Okay, and whether the patient is having a cyanotic or pale or mottled or natural color is there. So you have to look for that, and also simultaneously check with the, it's something like you just palpate like this way, and with the posterior side of your hand, you have to look for the warmth. Okay, simultaneously you can do that, hot, warm, cool and cold, that you have to look for that. Then next one is the other one you have to look for is whether the patient is having any sensation. Simultaneously you have to look for the pulses as well. So these three things, the pallor, the temperature and the pulses. So you have to look for the pulses. These are the pulses. What you are going to do is you will be getting the radial pulse. Okay, strong, weak, absent or Doppler will be there. So simultaneously you have to check the pulses on both arms. It's there. So you look for the pallor, the piclothermia, that is the temperature, and then you look for the pulses. So you chart it over here. You can tick it what is applicable for that. Okay, next one is you have to look for the capillary fill. So the capillary fill is you have to do it on the same finger on both hands. For example, index finger on both hands, that's okay, or third finger or middle finger, whichever it is applicable, you can do it on both sides. So what you have to do is you have to talk to the patient and press down the nail bed and count 1, 2, 3, 4, 5. Now I am going to release it 1, 2 and say capillary fill is less than check and capillary fill is less than 2 seconds. If it is okay, then you tick down over here. If it is more than 2 seconds, then you write it over here. Next one is you ask the patient, do you have a pain at rest or you have a pain on movement? So if it is there, you have to write over here. The other one is you have to look for the movement. So the movement, it is written over here. You just go to the other side where how you are going to ask the patient the movement. So this is the way you are going to look for the movement. So ask the patient like to abduct the fingers like this way. Okay, this is the way. See the picture over here, and then do it on both sides, and thereafter what you have to do is you have to ask the patient to hyperextend the thumbs. Okay, so the thumb is like this, go with the hyperextension like this way. Okay, so this is what is written over here, and then what you have to do is both hands you oppose your small finger and the thumb like this way. Okay, so this is the way you are going to do that. Okay, so these are the areas in which you have to look for that. So this is the movement. If the movement is okay, come down to the next page, it's here. Then you have to record that. the movement is there, present, decrease or absent, you can tick over here. Then the next one is paresthesia. So that you are going to look for sensation. There are two methods will be there. Paresthesia, there are the two methods. The first one is what you have to do is you can have an earbud. Ask the patient to extend both his arms and can use an earbud and close his eyes. Okay, then touch the the touch points. It's here, it's here, it's here, and on the posterior side it's here, it's here, it's here, it's here, it's here, and on the side over here. So this is going to check about the radial aspect. So what you have to do is you ask the patient, I'm going to touch the site, and if you feel a sensation over there, just say yes. If you don't feel, don't say anything. So if I'm going to touch like this way, the patient will say yes, 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 yes. Either you can use a safety pin or you can use an earbud. Okay, so this is the way you are going to check the sensory pathway. See, it's over here. So the numbness, you can look for whether the patient is okay there. Either if the patient is not having sensation, ask the patient, it's a numb, or do you feel any tingling, or there is no sensation at all. So whichever is applicable, you can tick it over here. Once you have done, then that's itself will finish the upper limb assessment. It's very simple. It's not too hard at all. You have a few more questions over there, and the scenario will be running down with an introductory phase, and then the procedure phase and the post procedure phase. Once you record these things, then it can come out. So in the next class, I will be discussing about the lower limb neurovascular assessment and the chart filling. So we will see what's going to happen in the lower limb. So thank you very much for listening to this video. I hope you have got an idea about how to fill up the upper limb neurovascular observation chart in the neurovascular assessment scenario in the Ossteil-Noske. So if you like the video, please click the like button, and also please share it for your friends and circles, and also please subscribe my channel. That will be an encouragement for me. I'm doing continuous videos on a regular basis on Australian, Irish, and the other one is the UK scenario. If anybody is looking for any videos in my native language, that's Malayalam, I am happy to do that. If somebody is looking for Malayalam videos, please do comment so that I am happy to do the Malayalam videos as well. The same scenario, I can do it in the Malayalam language as well. So thank you very much for listening to this wonderful video, and we will see you next time in another video. Thank you.